Welcome. In this Nclex mastery session, we're tackling one of the highest failure topics on the exam, fluid and electrolyte balance, with a special focus on the tricky potassium and sodium questions that frequently confuse test takers. Pay close attention to the clinical clues, priority interventions, and Nclex traps hidden in every question. Let's get started. Question 1. A nurse is caring for 4 clients. Which client should the nurse assess first? A. A client with a serum potassium of 5.8 milliequivalent/L reporting mild nausea. B. A client with a serum sodium of 128 milliequivalent/L complaining of a headache. C. A client with a serum potassium of 6.9 milliequivalent/L whose ECG shows peak T waves. D. A client with a serum sodium of 150 milliequivalent/L reporting intense thirst. Answer: C. A client with a serum potassium of 6.9 milliequivalent/L whose ECG shows peak T waves. Rationale: hyperkalemia with ECG changes is an immediate life-threatening emergency because it can rapidly progress to ventricular dysrhythmias and cardiac arrest. Mild hyponatremia and hypernatremia are important but are not as immediately dangerous as severe hyperkalemia with ECG abnormalities. Question 2. A client with syndrome of inappropriate antidiuretic hormone, SIAD, has a serum sodium level of 118 milliequivalent/L. Which provider prescription should the nurse question? A. Restrict oral fluids to 800 milliliters per day. B. Administer 3% hypertonic saline through a monitored infusion. C. Encourage the client to drink 3 liters of water daily. D. Monitor neurological status every 2 hours. Answer: C. Encourage the client to drink 3 liters of water daily. Rationale: SIAD causes water retention and dilutional hyponatremia. Increasing free water intake would worsen the sodium deficit and increase the risk of cerebral edema and seizures. Question 3. A client receiving 4 potassium chloride suddenly reports burning at the 4 site. What is the nurse's priority action? A. Increase the infusion rate. B. Stop the infusion and assess for patency. C. Apply a heating pad. D. Dilute the medication by adding sterile water directly to the 4 bag. Answer: B. Stop the infusion and assess for patency. Rationale: potassium is highly irritating to veins. Burning may indicate infiltration or phlebitis. The infusion should be stopped immediately and the 4 site assessed before restarting through a patent line. Question 4. Which assessment finding is most consistent with hypernatremia? A. Confusion, dry mucous membranes, and muscle twitching. B. Bounding pulse and crackles. C. Bradycardia with warm, flushed skin. D. Positive Chvostek sign. Answer: A. Confusion, dry mucous membranes, and muscle twitching. Rationale: hypernatremia usually results from water loss or sodium gain, causing cellular dehydration. Neurological changes and signs of dehydration are classic findings. Question 5. A client taking furosemide has a potassium level of 2.8 milliequivalent/L. Which finding requires immediate intervention? A. Diminished bowel sounds. B. Flattened T waves on ECG. C. Muscle weakness. D. Complaint of constipation. Answer: B. Flattened T waves on ECG. Rationale: ECG changes indicate that hypokalemia is affecting cardiac conduction, significantly increasing the risk of life-threatening dysrhythmias. Question 6. Which client is at greatest risk for developing hyperkalemia? A. A client receiving chronic dialysis who missed today's treatment. B. A client taking hydrochlorothiazide. C. A client with prolonged vomiting. D. A client with continuous nasogastric suction. Answer: A. A client receiving chronic dialysis who missed today's treatment. Rationale: missed dialysis allows potassium to accumulate because the kidneys cannot adequately excrete it, making severe hyperkalemia likely. Question 7. A nurse is teaching a client prescribed spironolactone. Which statement by the client indicates the need for further teaching? A. I'll avoid salt substitutes. B. I'll have my potassium checked regularly. C. I'll eat bananas every day to prevent low potassium. D. I'll report muscle weakness. Answer: C. I'll eat bananas every day to prevent low potassium. Rationale: Spironolactone is a potassium-sparing diuretic. Increasing potassium intake can result in dangerous hyperkalemia. Question 8. The nurse is caring for a client whose sodium level increased from 138 to 156 milliequivalent/L within 24 hours. Which assessment finding is most concerning? A. Restlessness and increasing confusion. B. Increased appetite. C. Mild ankle edema. D. Warm, moist skin. Answer: A. Restlessness and increasing confusion. Rationale: rapid hypernatremia causes brain cell dehydration, producing neurological symptoms that can progress to seizures and coma. Question 9. A provider prescribes potassium chloride 40 milliequivalent 4-push for a client with hypokalemia. What is the nurse's best action? A. Administer as prescribed. B. Clarify the prescription with the provider. C. Dilute it and administer over 5 minutes. D. Ask another nurse to verify before giving. Answer: B. Clarify the prescription with the provider. Rationale: potassium chloride must never be administered by 4-push because it can cause immediate fatal cardiac arrest. It must always be diluted and infused using an infusion pump. Question 10. A client with severe hyponatremia suddenly becomes difficult to arouse and develops generalized tonic-clonic seizures. Which action should the nurse perform first? A. Place the client on seizure precautions and maintain the airway. B. Administer oral sodium tablets. C. Encourage oral fluids. D. Obtain another serum sodium level before intervening. Answer: A. Place the client on seizure precautions and maintain the airway. Rationale: the priority is airway protection and patient safety during seizure activity. Severe symptomatic hyponatremia is a medical emergency requiring immediate stabilization before definitive correction with hypertonic saline. Question 11. A nurse reviews morning laboratory results for 4 clients. Which results should the nurse report to the provider immediately? A. Sodium 130 milliequivalent/L in a client with chronic SIAD who is alert. B. Potassium 2.9 milliequivalent/L in a client receiving 4-furosemide. C. Potassium 6.4 milliequivalent/L in a client with new muscle weakness and peak T waves. D. Sodium 148 milliequivalent/L in a client who has been NPO since midnight. Answer: C. Potassium 6.4 milliequivalent/L in a client with new muscle weakness and peak T waves. Rationale: hyperkalemia accompanied by ECG changes is an immediate cardiac emergency. Without prompt treatment, ventricular dysrhythmias and cardiac arrest can occur. Although hypokalemia also requires treatment, the presence of ECG changes with severe hyperkalemia makes it the highest priority. Question 12. A client with heart failure is receiving 4-furosemide. Which assessment findings suggest the medication is causing an electrolyte imbalance? A. Blood pressure 128/76 mmHg. B. Muscle cramps and irregular heartbeat. C. Respiratory rate 18 per minute. D. Warm, dry skin. Answer: B. Muscle cramps and irregular heartbeat. Rationale: loop diuretics commonly cause potassium loss. Muscle cramps, weakness, and dysrhythmias are classic manifestations of hypokalemia and require immediate evaluation. Question 13. A client with severe hyperkalemia is prescribed regular insulin with dextrose. What is the primary purpose of this therapy? A. Remove potassium through the kidneys. B. Prevent hypoglycemia while shifting potassium into cells. C. Increase potassium excretion through the intestines. D. Replace depleted glucose stores. Answer: B. Prevent hypoglycemia while shifting potassium into cells. Rationale: insulin temporarily moves potassium from the bloodstream into cells, lowering serum potassium. Dextrose is administered to prevent hypoglycemia caused by insulin. Question 14. A client with serum sodium 119 milliequivalent/L is receiving 3% hypertonic saline. Which assessment finding requires the nurse's immediate intervention? A. Crackles heard in both lung bases. B. Urine output of 45 milliliters per hour. C. Improved orientation. D. Blood pressure 126/80 mmHg. Answer: A. Crackles heard in both lung bases. Rationale: Hypertonic saline can rapidly expand intravascular volume, leading to pulmonary edema. Crackles indicate fluid overload and require immediate intervention. Question 15. Which client is most likely to develop hyponatremia? A. A client with prolonged SIADH. B. A client with diabetes insipidus. C. A client receiving tube feedings with inadequate water. D. A client with excessive sweating and minimal water intake. Answer. A. A client with prolonged SIADH. Rationale. SIAD causes excessive water retention, diluting serum sodium and leading to hyponatremia. Question 16. A nurse is monitoring a client receiving potassium replacement. Which finding indicates the treatment has been effective? A. Serum potassium increased from 2.7 to 3.9 milliequivalent/L. B. Sodium decreased from 145 to 138 milliequivalent/L. C. Urine-specific gravity increased. D. Hemoglobin increased. Answer. A. Serum potassium increased from 2.7 to 3.9 milliequivalent/L. Rationale. A potassium level within the normal range, 3.5 to 5.0 milliequivalent/L, indicates successful correction of hypokalemia. Question 17. A client with hypernatremia asks why they feel extremely thirsty. Which response by the nurse is most accurate? A. Your brain is responding to increased sodium levels by stimulating thirst. B. Your kidneys are producing too much sodium. C. Your blood sugar is causing the thirst. D. This happens because potassium levels are low. Answer. A. Your brain is responding to increased sodium levels by stimulating thirst. Rationale. Increased serum sodium raises plasma osmolality, stimulating the hypothalamic thirst center to encourage water intake. Question 18. The nurse is caring for a client with hypokalemia. Which medication should the nurse question? A. Digoxin. B. Acetaminophen. C. Ceftriaxone. D. Pantoprazole. Answer. A. Digoxin. Rationale. Hypokalemia increases myocardial sensitivity to digoxin, greatly increasing the risk of digoxin toxicity and life-threatening dysrhythmias. Question 19. Which assessment finding is most consistent with severe hyponatremia? A. Seizures and decreased level of consciousness. B. Dry mouth and excessive thirst. C. Hypertension with bounding pulses. D. Polyuria and increased urine-specific gravity. Answer. A. Seizures and decreased level of consciousness. Rationale. Severe hyponatremia causes cerebral edema, leading to confusion, seizures, coma, and potentially respiratory arrest. Question 20. A client receiving potassium chloride through a peripheral 4 asks why an infusion pump is necessary. What is the nurse's best response? A. The pump ensures potassium is infused at a safe, controlled rate. B. It keeps the medication from mixing with your blood. C. It prevents your 4 from clotting. D. The pump makes the medication work faster. Answer. A. The pump ensures potassium is infused at a safe, controlled rate. Rationale. Potassium chloride must be administered using an infusion pump because rapid administration can cause fatal cardiac dysrhythmias. Controlled infusion helps ensure patient safety. Question 21. A nurse is caring for a client with diabetic ketoacidosis, DKA. The client's initial serum potassium is 5.8 milliequivalent/L. Which action by the nurse is most appropriate? A. Withhold insulin until the potassium falls below 5.0 milliequivalent/L. B. Begin insulin therapy as prescribed and monitor potassium closely. C. Administer potassium chloride immediately. D. Restrict all 4 fluids. Answer. B. Begin insulin therapy as prescribed and monitor potassium closely. Rationale. Although serum potassium is initially elevated in DKA, total body potassium is depleted. As insulin therapy begins, potassium rapidly shifts back into cells, causing serum potassium to fall. Continuous monitoring and timely replacement are essential. Question 22. A client with hypernatremia is receiving hypotonic 4 fluids. Which finding indicates the treatment is effective? A. Serum sodium decreases gradually from 154 to 146 milliequivalent/L. B. Urine-specific gravity increases to 1.040. C. Blood pressure increases significantly. D. Potassium increases from 3.8 to 5.8 milliequivalent/L. Answer. A. Serum sodium decreases gradually from 154 to 146 milliequivalent/L. Rationale. Hypernatremia should be corrected slowly to avoid cerebral edema. A gradual return of sodium toward the normal range indicates effective therapy. Question 23. A client has been vomiting continuously for 3 days. Which electrolyte imbalance is the nurse most likely to anticipate? A. Hyperkalemia. B. Hypokalemia. C. Hypermagnesemia. D. Hyperphosphatemia. Answer. B. Hypokalemia. Rationale. Persistent vomiting leads to potassium loss through renal compensation and poor intake, making hypokalemia a common complication. Question 24. Which nursing intervention is the highest priority for a client with a sodium level of 116 milliequivalent/L who is becoming increasingly confused? A. Institute seizure precautions. B. Encourage ambulation. C. Offer oral water frequently. D. Limit neurological assessments to once per shift. Answer. A. Institute seizure precautions. Rationale. Severe hyponatremia can rapidly lead to seizures due to cerebral edema. Protecting the client from injury is the immediate nursing priority. Question 25. The nurse reviews the ECG of a client with severe hypokalemia. Which finding is expected? A. Peak T waves. B. Presence of U waves and flattened T waves. C. Widened QRS complex only. D. ST segment elevation. Answer. B. Presence of U waves and flattened T waves. Rationale. Hypokalemia commonly produces flattened T waves, ST depression, and prominent U waves, all of which increase the risk for ventricular dysrhythmias. Question 26. A client with chronic kidney disease asks why foods such as bananas, oranges, and potatoes should be limited. What is the nurse's best response? A. These foods are high in potassium, which can accumulate when kidney function is reduced. B. These foods increase sodium levels. C. These foods cause dehydration. D. These foods interfere with dialysis. Answer. A. These foods are high in potassium, which can accumulate when kidney function is reduced. Rationale. Impaired kidneys cannot efficiently excrete potassium. Excess dietary potassium can contribute to life-threatening hyperkalemia. Question 27. A nurse is preparing to administer oral potassium chloride. Which action is most appropriate? A. Crush the extended-release tablet before administration. B. Administer with food and a full glass of water if not contraindicated. C. Give on an empty stomach. D. Ask the client to chew the tablet thoroughly. Answer. B. Administer with food and a full glass of water if not contraindicated. Rationale. Oral potassium can irritate the gastrointestinal tract. Administering it with food reduces GI discomfort. Extended-release tablets should never be crushed or chewed. Question 28. Which client requires the nurse's immediate assessment? A. Sodium 149 milliequivalent/L with complaints of thirst. B. Potassium 3.4 milliequivalent/L without symptoms. C. Potassium 6.7 milliequivalent/L with new onset palpitations. D. Sodium 132 milliequivalent/L with mild fatigue. Answer. C. Potassium 6.7 milliequivalent/L with new onset palpitations. Rationale. Severe hyperkalemia with cardiac symptoms places the client at immediate risk for fatal dysrhythmias and cardiac arrest. Question 29. A client with SIAD has gained 2 kilograms, 4.4 pounds, in the past 24 hours. What is the nurse's priority interpretation? A. The client has developed excessive fat accumulation. B. The client is retaining fluid due to excess antidiuretic hormone. C. The client has improved nutritional status. D. The client is experiencing potassium depletion. Answer. B. The client is retaining fluid due to excess antidiuretic hormone. Rationale. Rapid weight gain in SIAD reflects water retention, not fat gain. Daily weights are one of the most accurate indicators of fluid balance. Question 30. A nurse is caring for a client with severe hyperkalemia who suddenly develops absent P waves and a widening QRS complex on the cardiac monitor. Which prescribed medication should the nurse administer first? A. Calcium gluconate 4. B. Oral sodium tablets. C. Furosemide by mouth. D. 0.45% normal saline. Answer: A. Calcium gluconate 4. Rationale: calcium gluconate does not lower the serum potassium level, but it rapidly stabilizes the cardiac cell membrane, reducing the risk of lethal dysrhythmias while other therapies, such as insulin with dextrose or potassium removal, take effect. Question 31. A nurse receives report on 4 clients. Which client should the nurse assess first? A. A client with a potassium level of 3.2 milliequivalent/L who reports mild leg cramps. B. A client with a sodium level of 129 milliequivalent/L who reports nausea. C. A client with a potassium level of 6.8 milliequivalent/L who develops muscle weakness and a heart rate of 42 per minute. D. A client with a sodium level of 150 milliequivalent/L who reports dry mouth. Answer: C. A client with a potassium level of 6.8 milliequivalent/L who develops muscle weakness and a heart rate of 42 per minute. Rationale: severe hyperkalemia causing bradycardia indicates life-threatening cardiac conduction disturbances. Using the ABCs, circulation is the priority because the client is at immediate risk for cardiac arrest. Question 32. A client with heart failure is prescribed lisinopril. Which laboratory value should the nurse monitor most closely? A. Sodium. B. Calcium. C. Potassium. D. Phosphorus. Answer: C. Potassium. Rationale: ACE inhibitors decrease aldosterone secretion, reducing potassium excretion by the kidneys. Clients are at increased risk for hyperkalemia, especially if renal function is impaired. Question 33. A client with severe hyponatremia is receiving hypertonic saline. Which finding indicates the sodium level is being corrected too rapidly? A. The client develops confusion followed by sudden lethargy. B. The client reports increased appetite. C. The client voids 40 milliliters per hour. D. The heart rate decreases from 98 to 86 beats/min. Answer: A. The client develops confusion followed by sudden lethargy. Rationale: rapid correction of chronic hyponatremia can cause osmotic demyelination syndrome, a serious neurological complication. New neurological changes require immediate provider notification. Question 34. A client with potassium 2.5 milliequivalent/L is receiving digoxin. Which finding requires the nurse's immediate action? A. Nausea and seeing yellow halos around lights. B. Increased appetite. C. Mild constipation. D. Blood pressure 118/70 mmHg. Answer: A. Nausea and seeing yellow halos around lights. Rationale: hypokalemia increases sensitivity to digoxin, making toxicity more likely. Visual disturbances, nausea, and vomiting are classic manifestations of digoxin toxicity. Question 35. Which client is at greatest risk for developing hypernatremia? A. A client with diabetes insipidus. B. A client with SIADH. C. A client receiving hypotonic for fluids. D. A client with Addison's disease. Answer: A. A client with diabetes insipidus. Rationale: diabetes insipidus causes excessive free water loss due to insufficient antidiuretic hormone activity, resulting in increased serum sodium levels. Question 36. A client has a serum sodium level of 122 milliequivalent/L. Which nursing intervention is most appropriate? A. Encourage unlimited water intake. B. Monitor neurological status frequently. C. Administer sodium-free for fluids. D. Encourage foods high in potassium only. Answer: B. Monitor neurological status frequently. Rationale: hyponatremia primarily affects the brain. Frequent neurological assessments allow early recognition of worsening cerebral edema, seizures, or declining level of consciousness. Question 37. A nurse is caring for a client receiving insulin therapy for DKA. Which laboratory result requires the nurse's immediate attention? A. Potassium decreases from 5.5 to 3.1 milliequivalent/L. B. Glucose decreases from 520 to 240 milligrams per deciliter. C. Sodium increases from 132 to 136 milliequivalent/L. D. Bicarbonate increases from 14 to 20 milliequivalent/L. Answer: A. Potassium decreases from 5.5 to 3.1 milliequivalent/L. Rationale: insulin shifts potassium into cells, which can rapidly produce dangerous hypokalemia. This places the client at high risk for cardiac dysrhythmias and may require immediate potassium replacement. Question 38. A client receiving potassium replacement has a urine output of 15 milliliters per hour. What should the nurse do first? A. Administer the potassium as prescribed. B. Hold the potassium and notify the provider. C. Increase the 4 infusion rate. D. Encourage foods rich in potassium. Answer: B. Hold the potassium and notify the provider. Rationale: potassium should not be administered when urine output is inadequate because impaired excretion significantly increases the risk of severe hyperkalemia. Question 39. A client with hypernatremia becomes increasingly restless and confused despite treatment. Which complication is the nurse most concerned about? A. Intracellular dehydration of brain cells. B. Hypocalcemia. C. Hyperglycemia. D. Respiratory alkalosis. Answer: A. Intracellular dehydration of brain cells. Rationale: elevated sodium draws water out of brain cells, causing cellular dehydration and neurological deterioration that may progress to seizures or coma. Question 40. A nurse receives the following prescriptions for a client with severe hyperkalemia. Which should the nurse implement first? A. Administer for calcium gluconate. B. Administer sodium polystyrene sulfonate. C. Teach the client about a low-potassium diet. D. Schedule repeat laboratory work in 12 hours. Answer: A. Administer for calcium gluconate. Rationale: calcium gluconate acts within minutes to stabilize the myocardial cell membrane and reduce the risk of fatal dysrhythmias. Although it does not lower serum potassium, it is the priority intervention before therapies that shift or eliminate potassium. Question 41. A nurse is caring for a client with severe hyperkalemia. Which assessment finding indicates the client is improving after treatment? A. Serum potassium decreases from 6.8 to 4.7 milliequivalent/L, and the ECG returns to normal sinus rhythm. B. Serum sodium decreases from 145 to 138 milliequivalent/L. C. Urine-specific gravity increases to 1.035. D. Blood glucose increases to 220 milligrams per deciliter. Answer: A. Serum potassium decreases from 6.8 to 4.7 milliequivalent/L, and the ECG returns to normal sinus rhythm. Rationale: successful treatment of hyperkalemia is demonstrated by normalization of both the serum potassium level and cardiac rhythm. ECG improvement confirms reduced cardiac irritability. Question 42. A nurse is assessing a client with severe hypokalemia. Which assessment finding requires the most immediate intervention? A. Muscle weakness. B. Abdominal distension with hypoactive bowel sounds. C. Frequent premature ventricular contractions, PVCs, on the cardiac monitor. D. Fatigue after walking. Answer: C. Frequent premature ventricular contractions, PVCs, on the cardiac monitor. Rationale: hypokalemia predisposes the client to life-threatening ventricular dysrhythmias. PVCs may progress to ventricular tachycardia or ventricular fibrillation and require immediate intervention. Question 43. A client with SIAD asks why fluid intake is restricted. Which response by the nurse is best? A. Restricting fluids helps prevent further dilution of your sodium level. B. Drinking more fluids will increase your potassium. C. Fluid restriction prevents kidney stones. D. Extra fluids improve kidney filtration. Answer: A. Restricting fluids helps prevent further dilution of your sodium level. Rationale: in SIADH, excess ADH causes water retention, diluting serum sodium. Fluid restriction is one of the primary treatments to gradually increase sodium levels. Question 44. A client receiving hydrochlorothiazide develops generalized weakness. Which laboratory value should the nurse expect? A. Potassium 2.9 milliequivalent/L. B. Potassium 5.8 milliequivalent/L. C. Sodium 152 milliequivalent/L. D. Magnesium 3.8 milligrams per deciliter. Answer: A. Potassium 2.9 milliequivalent/L. Rationale: thiazide diuretics increase potassium excretion. Hypokalemia commonly presents with muscle weakness, fatigue, and dysrhythmias. Question 45. A client with hypernatremia has been receiving 4 fluids. Which assessment finding indicates the client may be developing cerebral edema from overly rapid correction? A. Sudden headache, confusion, and vomiting. B. Increased thirst. C. Dry mucous membranes. D. Increased urine output. Answer: A. Sudden headache, confusion, and vomiting. Rationale: rapid correction of hypernatremia can cause water to move rapidly into brain cells, resulting in cerebral edema. New neurological symptoms require immediate intervention. Question 46. Which meal selection by a client with chronic kidney disease indicates the best understanding of a low-potassium diet? A. Grilled chicken, white rice, green beans, and applesauce. B. Baked potato, banana, orange juice, and spinach. C. Tomato soup, avocado sandwich, and yogurt. D. Sweet potato, dried apricots, and cantaloupe. Answer: A. Grilled chicken, white rice, green beans, and applesauce. Rationale: bananas, oranges, potatoes, tomatoes, avocados, spinach, dried fruits, and cantaloupe are high in potassium. The first meal contains comparatively lower potassium choices. Question 47. A nurse is evaluating a client's response to treatment for severe hyponatremia. Which finding indicates the treatment has been effective? A. The client is alert and oriented, and the serum sodium has increased from 118 to 126 milliequivalent/L. B. The client reports increased thirst. C. The client has gained 2 kilograms overnight. D. Urine output decreases to 10 milliliters per hour. Answer: A. The client is alert and oriented, and the serum sodium has increased from 118 to 126 milliequivalent/L. Rationale: improvement in neurological status accompanied by a gradual increase in serum sodium indicates successful treatment while avoiding overly rapid correction. Question 48. The nurse is preparing to delegate care for a stable client recovering from hypokalemia. Which task is appropriate to assign to an experienced UAP? A. Obtain and record the client's daily weight. B. Assess muscle strength. C. Evaluate cardiac rhythm changes. D. Teach the client about potassium-rich foods. Answer: A. Obtain and record the client's daily weight. Rationale: daily weights are routine, non-assessment tasks appropriate for UAPs. Assessment, evaluation, interpretation, and teaching remain the responsibility of the registered nurse. Question 49. A client receiving 4 potassium replacement suddenly reports chest palpitations. What is the nurse's priority action? A. Stop the infusion and immediately assess the client's cardiac rhythm. B. Increase the infusion rate. C. Encourage the client to drink water. D. Reassure the client that palpitations are expected. Answer: A. Stop the infusion and immediately assess the client's cardiac rhythm. Rationale: palpitations during potassium administration may indicate a serious dysrhythmia or overly rapid infusion. The infusion should be stopped immediately while the nurse evaluates the client's cardiac status. Question 50. A nurse is caring for 4 clients at the beginning of the shift. Which client should the nurse assess first? A. A client with sodium 127 milliequivalent/L who reports mild nausea. B. A client with potassium 3.1 milliequivalent/L who has occasional leg cramps. C. A client with potassium 6.6 milliequivalent/L who reports chest tightness and has a widened QRS complex. D. A client with sodium 149 milliequivalent/L who reports dry lips and thirst. Answer: C. A client with potassium 6.6 milliequivalent/L who reports chest tightness and has a widened QRS complex. Rationale: this client has severe hyperkalemia with ECG changes, placing them at immediate risk for ventricular dysrhythmias and cardiac arrest. According to NCLEX prioritization, ABCs and acute versus stable, This client requires immediate assessment and intervention before all others. Great job making it through these challenging fluid and electrolyte questions. Review any questions you missed. Focus on understanding the underlying clinical reasoning rather than memorizing facts, and keep practicing consistently. Every difficult question you master today brings you one step closer to passing the NCLEX with confidence.